on Everyday Life. My name is Egu Daniel Ifechukude, but you can call me SUG the General. Yes, on Everyday Life today, we're going to be talking about drug abuse. That's what we are going to be dissecting today on Everyday Life. So I have a medical practitioner here with me, and then it's good to have you in the studio, Victor.
Yeah, Victor.
Scientist Victor.
A medical laboratory scientist.
It's good to have you
in
here.
Delta State.
Yes. The way you said the medical laboratory scientist, I know he's it's a big profession. What exactly do you people do? Like, what exactly do you do? What's a profession all about?
We carry out diagnostic,
Okay.
precise and accurate diagnostics
Okay.
for patients who the doctor send their request to.
Okay, doctor has to send a request. So
yeah.
somebody cannot just come to you and say,
Most of
I want to.
Okay, most of the times the patients come directly.
Okay.
Most of the times we carry out a general test.
Okay, body test.
Body test.
All right,
body,
that's it's good to have you here. Then we have solo fight. Don't be like a typical Nigerian that he truly is.
Like
it's good to have you in the studio.
Like an Igbo man.
You're welcome, solo fight. It's good to have you here. Yes, today, guys, we're talking about drug abuse. We know that it's a menace in our society, a big one at that. And yes, you are a medical practitioner. Of course, you see them every day. You diagnose these things every day. And let us know what drug is. Let's start with drug. Then we can talk about abuse and its effects and
drug
causes.
is a chemical substance.
Okay.
Which is being applied or administered.
Okay.
Depending on the ailment or recommendation by your doctor.
All right.
It can be administered either through inhalation, that is administered through the inhalation.
Okay.
It can be ingested through your mouth or injected through your veins.
Okay.
So these drugs, they are chemical substances and they are responsible for probably healing process, you understand? But overuse or wrong use can lead to abuse.
Okay, that's the abuse. I was going to ask you to talk to us about abuse. So, simply put, wrong use of drugs
can lead to
that's abuse.
Yeah.
Okay, so we did not talk about drug abuse, or should we talk about it?
Yeah, we.
Okay, let's merge the both. Let's marry the both of them together. Drug abuse.
In a drug abuse,
Yeah.
It has to do with when, for instance, a person who consistently maybe is on a medication, maybe probably on a pain relief, and over time, the person's body gets used to it. And maybe the person has a feeling, whenever I take this drug, there's how the pain ease me. And the body system gets used to it. And over time, when the person take such pain relief, because of the body has gotten used to it, will probably not be able to feel that way and may want to take additional dose. Okay. And in such doing, compulsive, the patient resort to compulsive, what's it called, drug dependence.
Okay.
You understand?
The person's body becomes so dependent on the drug that without the drug, the person cannot perform anything.
Exactly.
Okay.
From there,
I wanted to relate it to somewhere, but let me know.
The person becomes addicted to it.
Because we've seen situations where, especially students, will tell you that, take this, take codeine, take tramadol. If you want to last 10 hours, take tramadol, take this. And we know that, of course, it has effect, but let's not dive into it just yet. We're going to talk about it. Okay. But you see people take those substances just because they want to impress who I don't know. And it becomes, because, of course, you know that bad habits is very easy to form, but very hard to change. Exactly. And your body gets used to it that without those substances, you cannot do anything at all. Now, solo fight. I know you're not a medical practitioner, but at least you study something related to not medical per se, but yes, kinetics, human kinetics, something that has to do with the body. Okay. Yeah, health education. Yeah, you are an educator, but health-wise. Okay. So, what are the simple causes of drug abuse? The causes.
Are you talking to?
I'm asking. No, I'm asking the medical practitioner. I know. Sort of I ask some questions. No, he's not a medical practitioner. He's just a health educator. He would educate us when by the time I get to him, so he will educate us. So, what are the causes of drug abuse?
Okay, there are many things that can cause drug abuse. Okay. So many people go into drug abuse depend on different scenarios. Okay. Some, it can be as a result of a medication they had been administered due to maybe, like I earlier mentioned, pain relief or something. Some, it can be depression. Depression can actually lead to people being going to drugs, and from there maybe they get addicted to it.
Okay.
Some like I said earlier. Okay, I haven't said. I haven't said it in this
Okay. Yeah.
presentation. Usually, addiction comes in. It doesn't come immediately. At first, the person takes it voluntarily, and over time, the body becomes so dependent on it, and the person is unable to get out from such addiction.
Okay.
You understand? So, depression can cause it. Peer pressures can even lead to it. You understand?
Yeah.
And some people also, as well, voluntarily want to take it, even when they know the effects. Over time, like you earlier said, some persons want to take tramadol because maybe they heard that their friends who
lasted for like 10 hours.
Lasted for 10 hours.
And did justice
and
to
say,
what I don't know.
If they can last for 10 hours, let me try it. You understand?
Yeah.
And when they try it once, and they saw the effect, maybe they lasted like 5 hours. The next time again, they want to take more. And over time, the body gets dependent on it. And even without it, they can't even function. And some will even continue to live on those drugs.
All right.
And they become addicted.
Yeah, of course, we cannot give the viewers everything in a day. Let me come to you, Solo Fight. Of course, you know one or two about this thing. Peer pressure. Let's talk about peer pressure. Do you think peer pressure works for everyone? Because I, for one, I don't believe in peer pressure. I know that such a word exists, peer pressure, but I don't believe that anybody can cajole me into doing what I ordinarily do not want to do. Solo Fight, do you think that peer pressure is, or does it exist in your dictionary?
Of course, peer pressure is conversant to almost everybody.
Okay.
You know, when you talk about peer pressure, if you look at the society now, everybody, they have peers.
Yeah,
they have peers that influence them, either negatively or positively. But before I will answer, okay, I will come to you.
No problem.
I'll come
Go
to you
on
later.
Okay.
But yes, peer pressure, of course, it has a whole lot of role to play when it comes to drug abuse, because you cannot be on your own without having peers. Of course, there are some things that you don't know, and you remain that way that you don't know it.
Yeah.
But when you have peers, you know, sometimes they don't get to tell you everything. Sometimes you see them do some certain things, and you want to be like them. And sometimes you want to do something, and you want to hear their 2 cents on what you want to do. You know, if they give you some sort of gratification on what you want to do, nothing stops you from doing that. After all, Mr. A, my guy did do am, my babe did do am,
let me
my
do
brother
it.
did do am. Exactly. So peer pressure, it has a whole lot. If we start talking about it today,
it's a topic on its own.
Okay, let me throw another question to you before I come back, or before I let you ask Victor some questions. Now, can you say that you have been negatively impacted by peers?
You know, when a child is growing up, when you get to the adolescent stage, I would say 80% of the time, there are a lot of things you're not aware of, and there are a lot of things you want to get involved in.
Okay.
If you don't have proper guidance.
Yeah.
I would say a lot of us growing up, at that stage, many has been influenced, you know, negatively by their peers.
Okay.
Many.
That's for the childhood stage
at the adolescent
or adolico.
stage, you know,
Okay,
when
adolescent.
When the youth want to explore.
Okay.
You know, want to
Youthful exuberance.
exactly,
I know
want to
that
know
feeling.
Everything, everything, you know, happening. Many has been led, you know, astray by peer. But like I said, peer pressure is
so it exists. It does exist in your dictionary.
Of course, it does.
Okay.
It does.
All
right.
You wouldn't say you have not been influenced.
No, as an adult,
Why
while growing up, of course, you could have been influenced. But as an adult, when you have the willpower, you can either say yes or no. I don't think that peers can influence me to doing what I don't want to do.
Okay.
I have so many things that I don't do that I cannot still do, even when influenced by peers. I cannot bring them over to my end, you know.
Make a point to what you said.
Okay.
You see, most of these addictions and or drug abuse we talk about, most of them started at that adolescent stage.
Okay.
Some more people get involved at that stage. Okay. You understand? Even taking of alcohol. Alcohol also is a drug on its own. People started taking it at adolescent stage. Even at childhood stage.
I have seen a parent, a father. I know. I'm sorry to pause. I've seen a father who check place all the time, like in the pool for eye every time. And this time he's showing. Let me use that word, even though it does not exist. Each time he's doing that, he would just take maybe a sip or two and then give to his child.
Okay.
And I'm like, at this tender age, this child is very small. And he doesn't know that he is negatively impacting on that child. Because by the time the child grows older, the child becomes independent, no longer following the dad to take shekpe or shayo, you know, and then the child starts doing it. And I thought for a second, this is how this is where it begins.
Even have you seen parents who smoke? Maybe the father smokes.
Of course, I have.
You've seen
I
some
have.
of the children.
I have.
Maybe the father did not finish it. They put it. They
Yeah.
go one place, hide it, and just understand. It starts from there.
Yeah.
At teenage years, you see them that way. Some of them also maybe some of these people may not have had that privilege of their father smoking.
Yeah.
But when they mix up with friends, maybe in universities at that teenage years, you see them. Maybe they are opportune to mix with people whose parents or whose children or the people, their friends who have been smoking right from childhood when they want to experiment.
Okay.
Some of them say test it, nothing there.
Yeah, test
Nothing, just test.
Some of them will say, stop behaving like I have had to take soft drinks. And a friend of mine told me, Afa now, you know, each time we go out, he will just let the waiter or waitress bring a woman drink. I'm like, what be this now? Even if you say bring her, I'm not moved. Say anything you want to say. It is me, now my body. By the time I get intoxicated or get high, or by the time he starts doing me training, now let me go there. You won't be there with me.
Okay.
I will be the only one to suffer the suffer. Okay. If at all. There is any
let me also get you that like put it straight that those teen people out of those friends, due to peer pressures, you see them over the time they get addicted.
Yeah.
Something they started voluntarily or something they were influenced voluntarily as well. From there, they get addicted.
All right.
Okay, we're not going to finish up because I know you have so much for us. But let me allow Solo Fight and ask you one or two because I'm looking at the time now and we have to wrap up, guys. But just Solo Fight, shoot.
You know, you've been talking about drug abuse. Can you just simply, differentiate between drug misuse and drug abuse for us?
Okay. Most of them are usually that is both drug abuse and drug misuse. Sometimes they are being interwoven, or used differently.
Okay.
Or like drug abuse. Drug abuse, like I said, is if for instance, you are given a recommended medication, for instance, by the doctor, and instead of they say take 200 milligrams or 20 milligrams. And over time, you have been taking this 220 milligram or 200 milligram, and you discover the thing is not, your body has gotten addicted. Why this thing, I know they feel well when I take this kind of thing. Let me take 400 milligrams. Let me double the dose. Without, maybe they may know the side effects or they may not. Over the time, their body gets addicted to it. Their systems start breaking down and all that. That is part of drug abuse. Then drug misuse. In fact, both of them like I said earlier, they are being interwoven. Okay. We have drug misuse disorders. We have drug abuse disorder. They are all interwoven. When you misuse a drug, something that is not meant for a particular purpose, you're taking something else. You understand? Yeah. And the drug abuse, too, both are usually interwoven. In fact, I can't differentiate the abuse and the misuse because you can either use them at interwoven.
Okay, times. Like interchangeably. Yeah. All right. Okay, so that's it. So the difference is not there's no much difference. Okay, according to the experts.
They both of them leads to addiction.
Okay.
Yes.
All right.
Addiction and even greater effects on the system.
Okay, you have other questions, Solo Fight?
Okay, I'm listening.
You've explained, according to you, you've differentiated.
I didn't really differentiate.
Like I said, there's a slight difference.
They work together, they come along together.
Yeah, they can be.
Can somebody be addicted to a certain drug without knowing that he or she is addicted to that drug?
Yes, somehow, but no in the other way around, because something like what do we call addiction? Let me define that word addiction. Okay. Addiction is something is a situation where you are used to a particular thing. Okay. And when you are not in connection with that thing, your life, your system looks like something.
To look like the whole world has collapsed.
Something is missing.
Yeah.
You understand? So when you can't tell me that someone who is maybe, for instance, taking marijuana, and you decide to suddenly withdraw the marijuana from him or her, and maybe even if for 1 hour or even a day, there's this feeling that comes into them that no, something is missing.
Yeah.
At that point, you know that person is actually addicted to it. Even alcohol. There's some people that they can't stay a day without taking alcohol.
That's true.
There's some people who a day they can't stay without even taking tramadol.
Well, addiction comes in different forms.
Yes, that's what I'm saying.
Yeah.
Addiction comes in different
Yeah.
forms. There are even like, if I may digress a little, even our phones, there's some people who can.
I wanted to talk about it. Yeah, without phone.
phones.
That's right.
There are so many addictions in people's life, but
Yeah.
today we are talking about drug abuse.
Yeah.
That when you've come to that situation where you cannot do without a particular drug, or you can't do without a particular substance, like alcohol, marijuana, or those, even hallucinogens. There are so many drugs, depressants and all that. It means your body has gotten addicted to it. I know there's some persons who are under medications like high blood pressure medications, BP drugs, diabetic drugs, and all those ones. But we can actually tell that those people are drug addicted to drugs.
Yeah,
because those ones are not really related to what we are discussing. They are not. Yeah, though they are drug dependent on that ailment. I mean, because of that treatment.
It's for a particular ailment.
Ailment. Like it's a recommended.
There are people who take it just because they want to get high.
Yes.
They want to
this
feel
one we're
irate.
talking about is when we talk about abuse and use. You don't need that drug, but your system, you want to take those drugs. Maybe you want to feel, you get that highness. You understand? So in that highness, you want your body, your brain has already been affected. You want, your brain will always want that system. That's why sometimes if you are close to someone who takes that, who is addicted or abused to those drugs, you see their system. It's how they fidget. Abnormality. Their system is already telling them, no, I need that. There's a particular substance, and once you give them that substance,
person is shaking. All of a sudden, person is shaking, and
that
immediately it comes.
You get the point.
There's this, of course. There's this, troubled waters. There's this calmness.
That's where the drug abuse and drug misuse and the addiction comes.
Okay.
Even the
So what is that thing that causes the addiction? Because I know that I used to hear of one word, caffeine, especially in drinks.
Let me talk about the addiction. There's this effect, the drugs. Is a substance in that creates this highness kind of picture in the brain. You understand? Which regulates the level of your happiness, and that's you understand dopamine. And so when this level is being created in the brain as a result of the substance you take, you feel that joy. That
country.
Yes.
You just feel that everywhere you stew. You know.
Understand? So over the time, your brain wants to feel that way. You understand? Your brain wants to feel that way. As you keep on supplying or administering your body system with those substances that makes your body feel that way, your mindset gets addicted to it.
I had a colleague in the uni who was lacking in confidence. At some point, the person, even when the person wants to talk to, could be a superior, somebody who is more superior than the person. The person needs some intake of alcohol to just boost her confidence level, And so I was wondering why the person was doing that until I asked questions and they gave me answers. Do you think it's okay for people to continue doing that, or we get them, experts to talk them out of? Because that person is already used to, and the person feels that each time she takes it, she gets this, she gets her confidence back. But each time she stays away from it, she lacks confidence. Talking to yourself might be challenging for the person. So in that case, what can you, as a medical practitioner, do for that person?
What I would say, usually it's difficult to change an adult.
Okay.
That's one statement I would say. For an adult to change, that adult has to cry out.
It takes the grace of God.
He or she has to cry out. He or she has to say, I want to change. This thing I'm doing is not helping me. Most of these people that are addicted, some of them you won't see them in the open.
Okay.
Most of them do this, take these substances in the closet. Except you are very close to them. You understand? I won't just come out and say, yeah, you are taking drugs. Let me come and talk to you. My dear, anything you see, you carry out.
That's right.
You get the point I'm trying to say. So the person has to cry out.
Okay.
Though I'm encouraging. Though
the person
I know,
cried out.
I'm coming.
By crying out, of course, the person decided to tell me.
Speak to you. Okay,
good. If the person had not told me, I wouldn't have known.
Yeah, if you know, if the person has told you and the volunteer say, look at what I'm passing through, the best is to ask the person to see a doctor.
Okay. Which of course I did.
Of course, when he or she gets to the hospital or to the doctor, definitely proper attention and resolution will be given to.
So drug. What you're saying in essence is drug. No matter how powerful the substance is, cannot give you overnight happiness. Cannot give you overnight confidence when you are lacking in one. That's what you're saying. Because people think that, yes, their brains are already used to the fact that...
As a false happiness.
Okay, false happiness. Pseudo happiness. Because something that...
Because it does not last.
Yes.
It does not last.
Yeah.
And it does not create that happiness you really feel that...
The real happiness.
The real happiness.
Okay. Yes. We need to wrap up, guys, in 2 minutes.
All right. You said you talked about families, you know, when the child is growing up, you see maybe the father smokes, or when he or she goes out, see the friends, maybe the friend's parents smoke.
The peer pressure.
Would you say that this drug abuse of a teen, you know, family plays an important role in getting their children addicted to drugs? Because when we're going to see some parents say, I'm feeling somehow.
Yeah.
Go and buy me this drug.
Chemist store, not pharmacy store.
Self-medication. Go and buy me this drug. So would you say when they grow up, they toe that line and end up being addicted? Like the family plays an important role in getting this drug?
Yeah, most families play an important role. Not all families.
Okay.
Most families do. Like there are some families that their fathers are into alcoholism. Their father are addicted to alcohol. They are addicted to drugs as well. Those ones, it's 90% chance that the children you raise in that kind of environment will be addicted to such, or will be influenced by such. You understand?
Yeah.
And that is another role. Another role is that most parents they are so busy that they don't even check on their children.
Yeah.
So busy. Some come back late at night. They don't even care to check their parents. Like when I was in school, our parents check our bags. They followed us up. They are checking. If they see anything strange from what they never bought for you,
or what they know you cannot offer.
So you get the point I'm trying to say.
Rather.
And every time, early morning, the devotion we have on they will talk about sex education, talk about drug, talk about so many things. You hardly, even myself who is talking before, I don't smoke, I don't drink, because I never had that environment.
Because
and they will always tell you about the consequences.
Of course.
You understand?
There's a biblical saying
even when for instance, we are going on the road, we see those ones that they are drinking kind or alcohol, strong drinks, and you see them dancing or almost falling on the street. They tell you, you see that, man, this is what you take when
this
you
is how you would end up.
All right, guys. So family plays a role, a negative
and positive. All right, guys. Thank you so very much, Victor, scientist Victor, for coming around. And Solo Fight, as always, thank you for coming. And yes, we have 2 sessions today. This is the first session, but this is where we'll be calling the wrap on this very one, because we have something bigger coming your way. But we're going to talk about the effects much later, and then proper sustainable solutions. Because it's not enough to provide solutions. We need sustainable ones that would help our young ones come out from this menace. It's a bad one. It's not giving us that's good. It doesn't make sense that you go to the hospital,